My name is Brian Becker, and I'm a family physician with DuPage Medical Group. I chose family medicine because I would not see just children, but also the whole family. So I liked having that dynamic of seeing some people I'd see, the grandparents, parents, and children. The person who inspired me most is my pediatrician, Dr. Maxwell. I had to see him often because I had a lot of earaches and strep throats as a child, and I had a very good relationship with him, as did my family, and I went to him until I was older than the parents that brought their children there. I grew up on a small farm in Ohio. I went to a very small high school. We graduated less than 90 in my class. Then I went to the College of Worcester in Ohio, which graduated around 500, and then went to the Ohio State University for medical school. Because even though my parents just had high school educations, they valued education very much and encouraged my older brother and twin sister and I to go to college. Now all three of us are doctors. During his whole life, I'd been a farmer, and my mom had helped on the farm, but I just saw the damage that it did to him, both in his physical body, joints, and his hearing. I don't see as many farmers. I do see a few, but I do see a lot of construction workers and people that do day-to-day manual labor. With them, I just have a better understanding of it than maybe some people that didn't grow up with a family that did that manual type labor, whether it be farming or construction or something like that. I understand more when these men and women are coming in and they're saying, their joint hurt, they're having trouble doing this, they have trouble doing that. It certainly does wear on their body, and you have to kind of look at them a little differently, treat them a little differently. What I love most about practicing medicine is the relationships. The relationships I developed with both the patient and their families. I build trust and respect first by respecting the patient themselves. Just being honest with people, being compassionate, and being down to earth. I always try to, if I'm explaining something to a patient and I get that clouded look in their eyes, that glazed look, I always try to bring it back to something they understand, whether it be their home life, their work life, or their past experiences.